Hey there, and welcome to another episode of Nutrition Essentials, an offshoot of our popular Health Essentials podcast. I'm John Horton, your host. Polycystic ovary syndrome, better known as PCOS, is a complicated hormonal disorder in women that's often misunderstood, and it comes with symptoms and side effects that can be troubling, to say the least. As women with PCOS search for solutions, they often find gobs of dietary advice online. Today, we're going to spend some time talking about what recommendations should be ignored and which are worth pursuing for the healthiest possible outcome. As always, we have registered dietitian Julia Zumpano with us to answer our nutrition questions. To learn more about PCOS, we're joined by a specialist from Cleveland Clinic's OBGYN and Women's Health Institute. Julia, who's with us today?
Thanks, John. Our guest is Dr. Kathryn Goebel. She's an OBGYN with a specialty in PCOS care. She works with her patients to create individualized treatment plans to better manage their condition. And diet is a huge part of that process. I'm looking forward to comparing notes with her to help women with PCOS feel at their best.
Well, Julia, between you and Dr. Goebel, I'm sure we're about to hear some great advice. So let's get started. Welcome to the podcast, Dr. Goebel. We appreciate you setting aside some time to chat about diet and PCOS, a condition that seems to be getting a lot more attention of late.
Thanks. Happy to be here.
One of the reasons why there's more talk about PCOS is that it's being diagnosed much more frequently. By some estimates, it's now believed that up to 13% of women may have PCOS, which is up pretty significantly from a few decades ago. Do we know why we're seeing such an increase, Dr. Goebel?
So I really think there's probably two things going on. I think there probably is a true increase in the incidence of PCOS, probably tied to the obesity epidemic. If you look at 25 years ago, the obesity rate in adults was about 30%. Now it's above 40%. In adolescents, it's now above 20%. This is really important for PCOS because most women will start having PCOS symptoms when they're adolescents. I think also, though, we're just seeing a lot more people talking about it. You've got celebrities, Victoria Beckham, Florence Pugh, Bibi Rexha, Lea Michele, all talking about their struggles with PCOS really publicly over the last few years. There's also a lot of social media influencers, particularly on Instagram, who are talking about health and wellness in the context of PCOS. And I'll say anecdotally, 15 years ago when I would diagnose someone with PCOS, they might not have ever heard of it, really have a lot of questions. Now I'm seeing more young women come in and saying, hey, I have these symptoms. Sounds like I might have PCOS. Can you test me for it? Is that what's going on?
That's fascinating how much the exposure has evolved. That's one of the blessings of our technology and the world we live in these days. For a little background, Dr. Goebel, can you please give us an overview of what PCOS is and what it means to live with that condition?
Sure. I mean, really at the root, PCOS is a hormonal imbalance problem, primarily caused by high testosterone levels, not boy level of testosterone, but testosterone levels that are high enough to change the signal to the ovary to release an egg on time every month. Because if you're not releasing an egg on time every month, then you're not going to get regular periods. So that can cause both women to have periods that can be really unpredictable, sometimes heavier, especially if they're skipping cycles, can also obviously cause fertility problems. If you're not releasing an egg, you're not likely to be getting pregnant on your own. Many women will also have cosmetic effects of the high levels of testosterone. These can be really bothersome. So increased acne, increased hair growth, particularly on the face, the chest, the back, really can cause a lot of body image issues. Some studies suggest that women, if you look at who are the same level of overweight, same body mass index, those that have PCOS have more anxiety, more depression, more eating disorders. And then in addition to the testosterone, and really what we're going to be focusing on today is the fact of the insulin disorder that is part of PCOS. So the high insulin levels and the insulin resistance can actually contribute to the higher testosterone levels. They basically feed back and make each other worse. We know that women who have insulin resistance are at higher risk for diabetes. They're at higher risk for heart disease because of the damage from the blood sugar to these tiny blood vessels in the system, high cholesterol, and sort of the combination of insulin resistance and cardiovascular disease. Sometimes it's called metabolic syndrome. And women with PCOS are at higher risk for this.
Dr. Goebel, do you find that there's still, though, a lot of misunderstanding that really just fuels worry about living with PCOS?
Oh, for sure. And again, when we're looking at, okay, now I have this diagnosis of PCOS, what does that mean to me? Am I going to be able to get pregnant and successfully have a family? What is that going to mean for my, ability to lose weight and maintain, good fitness throughout my life? What is it going to mean for my health when I'm older as far as my cardiovascular risk? Am I going to definitely be diabetic by the time I'm 50? So there's a lot, I think, of fear of, okay, now I have this diagnosis. What do I do with this?
Yeah, that's a lot to take in. I mean, everything you just listed off are like huge life issues, and you can see where it would really become something that weighs on folks.
For sure.
And I've seen a lot where they describe PCOS as metabolic chaos, which is just a great term.
For sure.
But it makes sense then that adjusting what you eat may help offer some balance within your system to maybe help manage the condition. I know we have a lot to cover, but let's start with the importance of choosing food based on what it means for your blood sugar levels.
Right. And so if you think about, like I said, with insulin resistance, that means you have at baseline higher insulin levels. So making those food choices to not drive those insulin levels higher and to not have those big spikes really can be very important, because if we can reverse any of those changes, and we know even for losing 10% of your body weight in PCOS, sometimes can get your periods to go back to normal without any other hormonal treatment. So there's really that balance of the insulin, your sugar levels, and then how that interplays with your testosterone production. It's all interconnected. And one area that we do have control over that glucose metabolism and the insulin is what we put in our mouths.
So just to piggyback off that, so when we think about trying to maintain lower levels of insulin, we're looking at dietary changes that include reducing, first of all, sugar containing foods and refined carbs, because we want to pick and choose the foods that are not providing us any nutrition first. So sugar sweetened beverages, sweets, desserts, baked goods, things of that sort. And then simple carbohydrates that are considered things like white bread, white pasta, white rice, white crackers. Again, we don't have to avoid them completely, but really significantly limiting those foods and coming up with more complex carbohydrates to replace them with. And the difference between a simple and a complex carb is that, simple carbs are broken down very immediately and quickly into glucose or sugar, which then leads to a rise in insulin, where complex carbohydrates provide fiber, maybe a little protein. That slows down the rate of glucose in the bloodstream, causing much less of a spike and therefore much less of a reaction of insulin.
Now it makes total sense, like with what you just said. If you eat some of these sugary goods, these baked goods, all those little things that too many of us we crave a lot, that it's going to cause a spike in your blood sugar. How does that then walk us through how that affects PCOS and how that rise in blood sugar then leads to these symptoms or what's happening?
Well, like I said, the worse your insulin resistance is, the worse the testosterone imbalance is going to be as well. So for somebody who has, PCOS and is having some, maybe milder symptoms, if they were to gain a significant amount of weight and follow a, simple carb diet that really is causing a lot of, insulin spikes and prolonged high insulin levels and then gaining weight, their testosterone balance is likely to get worse. Their symptoms with their acne and their hair growth is likely to get worse. Their irregularity of their menstrual cycle is likely to get worse as well. Conversely, we know that a lot of these changes are reversible with dietary changes and with weight loss and healthy lifestyle. And that can improve even the hormonal effects like the regularity of the period just by changing those lifestyle choices.
One thing I want to note too is that, we know that these foods can be addicting. We know that they can be hard to cut back on. I call them hyper palatable foods. They're designed for us to want to consume and want to consume large amounts of them and continue to purchase them again, right? So it is kind of difficult to, initially get away from these foods, but as you reduce your intake of these refined sugars and processed foods, and manage your blood sugars, the management of your blood sugars will aid you in less cravings. So if you can better manage your blood sugars, your cravings will improve. And as you decrease the foods, and in some cases, some people need to initially eliminate them to get things kind of settled down and managed, it will really help your appetite and your craving towards these foods. So that balance is really key for success. And we never want to say we want to eliminate anything from the diet. We know all foods can fit, but initially cutting those out and then slowly adding them back in. And then again, combining foods with, a healthy fat and some protein can really help your blood sugar reaction and help minimize the amount of insulin you're producing after consuming those foods.
Yeah, absolutely. Because if you eat something that is just a pure, simple carbohydrate meal, 2 hours later, you're gonna have sugar's gonna have crashed, and you're gonna be looking in the break room to see if there's donuts. But if you're having a healthy, well balanced protein, fat in your diet that's gonna maintain those steady blood sugars, you're not gonna have those crashes and spikes and those cravings. And also for somebody who is able to really minimize or cut down on the sugars at the beginning of this change in their diet, amazing how very sweet fruit taste when you haven't been eating the processed foods and the really, really, artificial sugars that really just affect our taste buds and what tastes good to us.
It's amazing as you guys have been going over all this. It really stands out just how complex this is and the layers that we're kind of dealing with here. Like one thing leads to another, and they all kind of work together to complicate these problems. One thing that kept coming up was weight gain, which I know is a real common side effect of PCOS. And it seems like those extra pounds do worsen the symptoms that kind of come with the condition and can lead to some of these other issues too. Can you kind of walk us through a little more of this kind of complicated relationship between PCOS and weight gain?
Sure. And like you said, it is complicated, right? Because, being overweight or obese can help trigger these metabolic changes that can cause a lot of the symptoms of PCOS.
Your body just doesn't work the same. I mean, You have that extra weight. There's a lot going on.
But when you're somebody who has, chronically high insulin levels, it can make it harder to lose weight, as well. And then when you look at the, compounding effect of the body image issues in women with PCOS, it's really a setup for very disordered eating. So, some women will experience binge eating. It is much more common in women than men. But even for those who don't meet the diagnosis of a binge eating disorder, what is extremely common is what I just call emotional eating. So emotional eating is basically consuming these processed, high sugar, high fat foods. And really, it's trying to buffer your feelings. You're eating not because of hunger, but because of what you're feeling. And this is modeled particularly to women from a very early age. Think of every, after school sitcom that you watched as a kid. There, the main character broke up. They were shown eating a pint of ice cream.
Pint of ice cream, yeah.
Look at, today on social media, the whole little treat culture. Most of the time, those are food and, sugary treats, fatty treats. There's the whole subset of mommy wine culture. It's treating yourself with something that maybe is not in your best interest nutritionally, to brighten the monotony of parenting, as a consolation for a bad day, to reward yourself, for getting through a task. And then the other effect of alcohol use as well is that we know that alcohol lowers your inhibition and increases the risk for binge eating as well.
I think those are two great points. In my patients, I see a lot of emotional and binge eating. It's hard to decipher the difference between the two, but usually I ask a couple screening questions, but if when you suffer from binge eating disorder, it's usually when you're consuming large amounts of food and you feel out of control. You feel like you don't have control of your eating. And then usually it's unfortunately followed by feelings of guilt or depression, or even worse feelings from when you began, and even more like uncomfortable feelings from a gut perspective, or how you're physically even feeling uncomfortable. And if that occurs more than 3 times a week, we usually classify that as binge eating disorder. The emotional eating piece may not necessarily include a full binge, but it may just be that anytime you're stressed, you're grabbing chocolate or you go through the drive-through, whatever your vice might be, you're feeding your emotion, whether it be good or bad, with food as a soothing technique. So what we try to do is we try to come up with other ways to soothe. We replace the food with another soothing event or distracting event. So soothing may be taking a hot bath, maybe simply, taking some deep breaths. Distraction could be calling a friend or going on a walk. So there is a whole list of options we have. And of course, you can come up with your own. So anything that will either distract you away from that emotion or soothe you in a non-food related way. So even from when I see children, I try to encourage parents not to reward their children with food. So if you're going to reward your child for good behavior, starting with good habits when they're young, as rewarding them with maybe, an extra TV show, or a friend gets to come over, whatever it might be, but just not a food related treat.
Yeah. The other thing I find really helpful for my patients who struggle with emotional eating is food journaling. And I think, again, there's lots of different ways to do food journaling that work for different people. Personally, I like it very simple. Just write down the food just before you put it into your mouth. Because even if that just gives you that split-second pause, am I eating because I'm hungry, or am I eating because I'm bored, I'm angry, I'm frustrated, I'm lonely, or there's some other feeling? And so even if it's not immediately someone is ready to change their behaviors, that food journaling can help them see, okay, when is it that I'm not having the willpower that I want over my eating? Am I an evening snacker? Does it make sense? Well, maybe, when I put the baby to bed, should I brush my teeth before I come back downstairs? So I'm not having that mental cue of it's still time to be eating. For young, moms with young kids, are you eating the grilled cheese crusts and the, little cookies that are left over on the tray every time instead of putting it in the garbage? That sort of, food that you're not thinking about, unplanned eating, can really add up, because a lot of the times those are not good, healthy choices. And so I think really starting with that food journaling to see, what am I eating? When am I eating it? And then just kind of be more mindful about our eating.
I love the idea of food journaling. I recommend that all the time, regardless of what your health goal is. I think it's very eye-opening. It gives you ideas of your food trends, your timing, etc. One thing I do encourage is taking it a step further, is when you're writing down what you're eating, to also note your emotion. So then you can also note if there are times of your day you feel that emotion, if there's certain emotions you crave certain foods with. And also sometimes it could just be justifying to write down how you feel, because actually what we're trying to do is express or release that feeling. And we may feel like we're trying to do that through eating, but if you're able to write it down or journal it, you may be able to just release or express that feeling in that way. And you may be less inclined to serve that emotion with food.
Yeah, you guys have really just portrayed so well the complicated relationship all of us seem to have with food and weight and how that goes together. And with PCOS, it seems like it's exasperated even more. So for Julia, with someone with PCOS, what should they be looking to put on their plate? What should they be filling out their food journal with if they want to try to keep the condition under control?
Sure. So no surprises here. Same theme. We're looking for whole foods, high fiber foods, and good sources of lean protein. So things such as whole grains, fresh fruits and vegetables, nuts and seeds, beans or legumes, lean meats such as chicken, turkey, lean beef or pork, fish or seafood, and then healthy fats such as extra virgin olive oil or avocados. So a really good balance of whole foods, making sure you're getting tons of fiber and tons of healthy fat, because fiber and fat are what put the brakes on your sugars. Your blood sugars will really be best managed if you're consuming enough fiber and healthy fat with meals, and of course, protein. But those three nutrients are essential for the management of blood sugars. And a lot of times people aren't consuming enough healthy fat and protein, which is what causes them to crave carbohydrates. And carbohydrates aren't bad. They're our body's main source of energy. We certainly need carbohydrates, but we need the right kinds, the kinds that are packed in fiber. And that will lead to the best blood sugar management and the best outcome. And bonus, all of these foods are considered anti-inflammatory, which we'll talk in a minute about that, the benefits of, eating an anti-inflammatory diet for PCOS and just overall disease prevention and management.
One thing too, I think we need to emphasize is just, you had mentioned whole foods, but the flip side of that is staying away from ultra processed foods. And I read something where they talked about the JERF concept, which I'd never heard before, and I really liked it. I guess that stands for just eat real food.
Yeah, I love that concept. Certainly, yeah. So we know to avoid, those packaged foods, those things that call to us, potato chips and cookies and crackers and pretzels and sugar sweetened beverages and alcohol and, high amounts of caffeine. Those are all stimulant foods, and they're going to cause you to want to consume them more. And they may even skew your thought process around, okay, it's okay to have these. And you'll just consistently kind of get in this bad habit of a loop of consuming these foods. And then your blood sugar is all out of whack. And, then our body's kind of in this metabolic distress, as we're talking about. So really feeding your system to have, manage blood sugar and success around, managing your food choices.
And I think this is where meal planning really is super duper helpful. I mean, if your pantry is full of all of those super processed foods and you come in the door at 6 p.m. and you're hungry, you're not going to make the best choices. Now, this is about, sitting down and saying, okay, how am I going to feed myself and my family this week? How can I make choices that are good ahead of time? Can I make, a healthy dinner and make an extra portion that I can bring to work tomorrow for lunch, as opposed to whenever in the office is like, oh, do you want to order lunch today? So how can you make as much of those food decisions ahead of time instead of in the moment?
I completely agree. Planning ahead is essential. Really, that grocery shopping trip is where it begins. So when you're grocery shopping, that's when you really want to make sure you fill your cart with all of those foods you should be consuming, the foods we just spoke about. Planning your meals ahead so you have everything. Planning for those nights where just life happens and you just had no time to cook dinner. Well, what are you going to do? What is, a 10 to 15 minute meal you can pull together and still feel really good about? So it's really essential to have, a stockpile of good food, healthy foods in your freezer and your fridge, so you have no excuse to, stray.
And I want to ask here too, if you go search online, there are no shortage of sites where you see where something's labeled as like, the magic food. This will cure your PCOS or make everything go away. There's no magic item that's going to take care of everything, right?
Nope.
Absolutely not.
No, it's really going to be, what are those day in, day out choices that you're making? And, like we had said, I don't think there is any food that is inherently evil and bad, but I think you need to look at your overall eating plan. And is there a little bit of room for joy in your eating? Absolutely. But do you need to have that in the context of a well-planned, well-balanced diet that's really going to meet what your health goals are? Yes.
I also think a little bit of a mindset is important here. So just really embracing a new lifestyle, a healthier way of eating, embracing what that means to your body, embracing the fact that you're making and taking an initiative to improve your health and feel better. And hopefully and ideally, as you do that, the weight will just naturally, hopefully come down, right? And you'll feel better, right? You'll feel better. Your blood sugars will be better managed. You'll have, better self-image. So I think that's really important too, is the mindset piece around it. I think if we walk into a plan knowing and feeling deprived from the beginning, that plan's not going to be sustainable. So I think it's important to not deprive yourself, but really look at it in the form of, I'm treating myself.
I love that mindset idea. I know my wife will get me to eat more cucumbers because she cuts them up real long and they're cucumber fries. So all of a sudden they taste better,
Mm-hmm. I load cucumbers with salt for my kids to eat them and they'll eat them up. So it's little tricks that that you do. And of course, I can't say it enough, is just like taking that ownership of your health, taking that, be in the driver's seat of, you're changing your outcome.
So Julia, you did a little foreshadowing for us when you brought up anti-inflammatory foods. So let's spend a little bit of time talking about kind of why those are so important for managing PCOS.
So for me, from a food perspective, inflammation happens all around the body. So we know that there's acute inflammation and chronic inflammation. And when our body's in a state of distress or metabolic distress, we have inflammation. When our blood sugars are out of whack, when our insulin level is high, when we have a little extra weight on us, those are all markers for inflammation. And, when we can feed that inflammation by the food we're choosing to have, all those ultra processed sugary foods are only going to support that inflammatory process to continue or worsen, or we can try to suppress that inflammation by the food choices we make, by choosing foods that are high in omega-3 fatty acids like fatty fish and chia seeds and flax seeds, hemp seeds, and choosing whole foods like fruits and vegetables and grains that provide us those anti-inflammatory compounds that can stop that inflammatory process or at least slow it down.
And it's really important to remember that, when we're looking at the insulin resistance side of PCOS, we're looking at chronically high sugar levels and insulin levels, which are causing damage to the blood vessel linings. And that's that long-term, what we call endothelial damage or damage to blood vessel linings that causes heart disease and really, end organ issues such as kidney disease as well, that can go along with diabetes, high blood pressure, high cholesterol, all of those things that are part of that metabolic syndrome. So the pro-inflammatory environment in there is something that, like I said, food is one more tool that we have, to counteract some of these challenges to our bodies.
And it seems like it is very much a day in and day out thing. I know we all like that instant relief, or, it's an instant solution. But when you're talking about inflammation, it is what you're eating day after day after day that kind of sets your body up for how it's responding.
Absolutely. Absolutely. So, you have a cookie here and there randomly, not going to be a big deal.
Yeah, you get your one little spike and it comes back down.
Right. If you're eating a whole foods, well-balanced diet, that's where we can have that treat and be okay. Our body will adjust and respond. But if we are consuming it day after day, day in and day out, and it's leading to that metabolic distress, that insulin resistance, as Dr. Goebel said perfectly, what it does to the inside of our arteries and the lining of our blood vessels, and the reaction that we can have from a cardiovascular standpoint and our other organs is where we see that significant inflammation when you're eating these ultra processed, highly processed, high sugary foods, fast foods, convenient foods on a day-to-day basis. Something else to note too is I think we tend to demonize things like sweets or snack foods. There's a lot of sweets and snack foods that can be considered more healthy than others. So you can still incorporate those a little bit more regularly, as long as you're choosing more on the healthier side. So, something like a homemade oatmeal raisin cookie with, all homemade ingredients, no synthetic ingredients. And, maybe you reduce the sugar and use some applesauce or a banana. And maybe you roast some potatoes or cut them really thin, and you make your own chips or kale chips, or, whatever you can do to incorporate that snacky food that you might want. There are ways that we can incorporate the flavor and the desire of the texture of the food we're looking for and still make it healthy.
So when we're looking at then setting up our eating plan, everybody likes diets because it kind of gives you a little bit of a game plan. Are there certain diets that kind of stand out as being ideal for someone with PCOS?
I think just a blood sugar management diet would be the most ideal. So just really key point here is a good balance of macronutrients each time you eat. So adequate fiber, protein, and healthy fat. Now, when you look at, inflammation, and we're talking about that a lot, we know the Mediterranean diet is a naturally anti-inflammatory diet. It's
Answer
high
for
in
everything,
fiber.
it seems like.
It's a great answer. The Mediterranean diet,
Yeah.
because it's the nice thing about the Mediterranean diet is we know it's so anti-inflammatory, with the fishes, with the olive oils, with all the healthy fats, but it's also a deeply satisfying diet. It doesn't feel like a diet that you're cheating yourself out of eating good stuff on. There are lots of great, beautiful, delicious meals that are part of a Mediterranean diet. The other thing, that we can talk about here is a little bit is intermittent fasting, because that's something that gets a lot of attention when we're looking at, glycemic index diets, PCOS, insulin resistance. And I think intermittent fasting can be helpful, but I think it needs to be considered carefully. Because when you think about really what intermittent fasting is meant to be, it's meant that you are to consume a day's worth of a healthy, beautiful, well-balanced diet within a restricted number of hours. And the reason for that is to affect your insulin levels. So insulin is essentially a storage hormone. It says, take my blood sugar and store it in my cells for later. So if you have your insulin going all day long because you're snacking all day long, you're sipping on your iced coffee that has sugar on it all morning long, your insulin is running all that time. So you're constantly in storage mode. So the goal then is to minimize the number of hours that those insulin levels are high. But we've talked about a little bit, women with PCOS are a little bit more prone to disordered eating and to binge eating. And so intermittent fasting can be for some people a slippery slope to a very disordered eating. It's not designed to be a cycle of starvation and binge eating. It really needs to be, you really need to think about it as this is what you eat in a day, which is a normal, healthy amount of food, a well-balanced diet, just considering the hours in which you eat it.
Yeah. Is there a target that's kind of ideal then to look for if you're going to intermittent fast to limit it to a certain time frame and not go too far?
And there's a lot of different, on this, and you can speak to this as well. But, a lot of people will say, okay, well, what is actually manageable for me? And so for a lot of people, the 8-hour window is very manageable. If you're somebody who does not wake up hungry and is fine with just your black coffee or tea in the morning, then if you eat from noon to 8 p.m., that's very reasonable. You can still be social and eat with your family and all of those things. If you're someone who really needs to eat when you wake up, maybe that needs to be shifted earlier. And I don't know that there's a magic number for every person, every disease process, but really I think it requires, especially, for those of us that have a family that we want to eat with, it requires a lot of forethought so that you're not feeling, that deprivation, because what happens when someone is on a diet where they feel deprived, they don't stick with it.
Yeah.
I agree. I even start people at a 12-hour window. So just, knowing that let's just start with 12 hours. Let's just make sure we're cutting off at 8 and we're eating at 8, or we're cutting off at 7 and eating at 7, depending on the person's lifestyle, when they wake up, when they sleep, etc. And then I build from there. So I may go from 12 hours to then 10 hours and then 8 hours in your eating window. So, and some people just kind of hang out at 10, 12 or 10, but they're still maybe making huge improvements if they're eating, a good amount of calories after 8 p.m. So I think it's important to note that, studies have shown that even a 12-hour window has shown nutritional benefit and blood sugar management benefits. Of course, as you fast a little longer, you're going to get a little bit more benefit from eating in a 10-hour window or 8-hour window. But, we want to start where it is reasonable. So usually start with a 12 to 10-hour eating window and then advance to an 8 if that's something you're willing to do. And I also think it's important to know when you wake up and when you go to sleep. So I do try to pair that window. Like if you're, always getting up at 5 and you're waiting till noon to eat, I think that's way too long. Yeah. So I think it's really important to try to, I like to shave off 4 hours on either end. So like if you're going to do 4 hours after you wake up and stop eating 4 hours before you go to bed, assuming you're going to sleep 8 hours, which would be ideal. So that's usually kind of my methodology of thought. But I think that's what I love about time restricted eating, is that it's very, very flexible. And I also, a trick that I do is I always give people one non-fasting day a week, because then they just don't have to worry about it, or even 2. 2 non-fasting days a week, and they just don't have to worry about it, and they can maybe enjoy their weekend or whatever without having to worry about the timing that they're eating.
Right.
Dr. Goebel, you mentioned kind of that slippery slope, because we've talked about how with PCOS, it can maybe open the door to disordered eating. If you are going to play around with intermittent fasting and try that, how do you know whether or not you've hit that slope and you're starting to slide a little bit? Are there some signs that you kind of advise your patients to look for just to make sure they're still on solid ground with their diet and nutrition?
For sure. And I think, really what is super helpful, even more so for when you're planning this timed eating is planning ahead of time, really, is saying, okay, well, this is sort of my schedule for the week. This day, this 10-hour window might work better. I might have to shift it the next day because of, an exercise routine, or when my kids need to eat because of sports. Like we said, on the weekend, maybe things need to be a little bit more lax because of things that are going on. But I think where you start running into trouble is when you get into the mindset of, I can eat whatever I want as long as I stop by this time.
Yeah.
And that is where we see people really kind of running into that scarcity mentality of like, I need to eat all the food before 7 p.m. And so I'm just going to gorge myself. I'm going to get into, flirting with those binge eating behaviors. So I really think it needs to be, look at what is a day's worth of a healthy diet for you. What hours are you going to choose to eat it within? But it is not a free for all during those restricted hours.
Right. That's why sometimes when you have that 12-hour window too, you can space your meals a little bit more spread out, consume 3 meals, and then really better manage your blood sugars and not feel restricted. I think it's that restriction piece that people don't like, whether they're restricted in timing or food. And then it creates this like, oh, I'm never going to be able to have this until just now. So I have to consume as much as I can as possible. So it's just that like restrictive mind. So
the
just
forbidden
being
fruit
able
theory, whatever you can't have is all of a sudden even better.
Exactly. All of a sudden, like, I can't eat a minute past 7, so I have to consume everything before then. Well, if you're tight on time, I usually tell people, well, why don't you just push it till 8 this day? Instead of just feeling like you have to shove everything in, let's just add an hour.
Be flexible, be okay with live your life and make sure you fit it in there, and don't overly worry if you're half hour over or something happens one day.
Flexibility is key. It's so important when it comes to sustaining healthy eating habits. You have to be flexible. And then that leads to better metabolic flexibility. We want our body to be able to respond in a good way to that flexibility, not negatively affecting us.
And those really sort of restrictive, thoughts about eating, again, that is what we see, in disordered eating. We see that, if you're thinking about food all the time and you're having that, okay, I have to eat all this food quickly in a small amount of time. Is there shame associated with that? Like I said, there's a lot of those patterns. And that's why, like I said, that intermittent fasting or timed eating can be a great tool for some people. It just is, you have to be with, certain personality types. You just have to be aware of monitoring what is your thinking around your food. Are you starting to have those really compulsive thoughts about food and what you need to eat when you need to eat it? And is that becoming a challenge for you? In which case, that might not be the best approach for you.
Yeah, this seems like a good time too to bring up the whole concept of all the restrictive diets that you see, those fad diets that Dr. Google seems to throw out there a lot. Those are not ideal for people to kind of seek out as a solution to issues with PCOS, right?
No, I mean, it's more restrictive. It's kind of the same concept we're following. So like more restriction leads to a little bit more of that emotional eating piece, restrictive eating. It's just kind of an emotional and physical roller coaster. So I think just having a well-balanced diet, a whole foods-based diet, managing your blood sugars throughout the day, finding an eating plan, meaning which foods you enjoy and will and can consume on a regular basis, is ideal. If that follows more of a high protein profile or a higher fiber profile, it just kind of can sway, but still whole foods, still managing blood sugars through the balance of your macronutrients, and not anything overly restricted, no fads, nothing where you're feeling like, okay, I can follow this for a month, but
Yeah.
after a month, I'm done. If you have that mentality, it's not the right plan.
People will lean on those fad diets as a quick weight loss thing or something like that, but it seems like they lead to trouble eventually.
Because what's going to happen is when you have these very restrictive diets, and yeah, you might lose some weight in fairly quickly, but these are not things that you can maintain
Yeah.
because you're depriving yourself. You're not getting enough calories in some of these diets, or you're just not getting the nutrients that you need. Like Julia said, we really want to focus on a well-balanced, colorful diet, plenty of fruits and vegetables, protein sources, healthy fats, which is really a very, again, satisfying diet. It's just about making those good choices. If you're on a very restrictive diet, you're unlikely to maintain it. And we know from, lots and lots of years of study of people doing this yo-yo dieting, they often, once they stop, will then end up heavier than they were before, which not only is problematic from, the metabolic, part from PCOS, if they have that increased weight gain, but also from a self-esteem standpoint. If someone is struggling, with all of these, feelings of that they're powerless over their diet, if they're, failing at these fad diets, it really is just not good for your overall wellness.
I completely agree.
Yeah. And I'm glad you brought that up because from everything we've talked about today, I mean, this kind of PCOS being an emotional roller coaster is very much out there. And it seems like it affects people on so many levels. So Dr. Goebel, in your experience, if someone does start adjusting their diet and they make some of these healthier changes, do they start seeing a lot of these symptoms kind of fade and they're better able to manage the condition?
Yeah, I think, there's two ways to think about this, right? There's, okay, can we get your metabolic syndrome to kind of reverse? Can we get enough of an anti-inflammatory effect? Can we get, weight loss? Can we get the insulin levels down, which is then going to, help with our testosterone levels as well? But there's also, like we were talking about, there's the emotional part of it, right? Can we work on, if you're able to maintain a healthy diet, if you are taking care of your body and moving it in a way that feels good to you, getting some cardiovascular exercise, doing weight training, sleeping well, minimizing the caffeine, staying hydrated, all of the things that just make us feel good in our bodies, is that going to be able to help with your self-esteem component? And then that feeds right back into, if you're feeling good about yourself, you're less likely to be emotional eating. And I think for those for whom emotional eating or binge eating is really, a problematic part of their diet, I think doing the work with, a registered dietitian, a life coach, psychiatrist or therapist, I think really getting to the root of, for somebody who is eating not for hunger reasons, what other ways, can you sort of buffer those feelings? How can you work through that? But I really feel like, doing all of these lifestyle changes that will just make you feel good in your body are going to not only help you from a metabolic and from a hormonal standpoint, but really just then help you to optimize what you have over control over this condition.
I can't agree more. I think it's super important to understand your other lifestyle factors. Exercise makes you feel good. It increases endorphins. It helps, relieve emotion. So it's really important to whatever physical way you can move your body that makes you feel good. That's going to be key here. Getting enough sleep. Studies have shown when you don't sleep enough, we tend to eat poorly because we're searching for energy. We're searching for that energy boost. And we're so tired, we're not making good choices because we don't care at that point, right? So I think that it's really important to look at all three facets: your sleep, your exercise, and your nutrition. And then those can also help you manage emotion and stress.
Yeah, Dr. Goebel, you had mentioned earlier too, kind of PCOS and how it can affect family planning for people. How much of a role then does the dietary part come in that when people are at that stage of their life and they're looking to kind of get the condition under control?
Sure. So when you're looking at, PCOS from a fertility standpoint, really the big problem is if you're not ovulating. So if you're not releasing an egg because of this hormonal imbalance, that can really cause, some fertility struggles for women. Now, there are certainly hormonal treatments available to help with ovulation, but we also know, as I mentioned earlier, that, weight loss in and of itself can help to restore ovulation and, regulate those periods and help with fertility. There are, some studies that suggest inositol, which is a supplement, can also be helpful, to help regulate to cycles as well. Magnesium, vitamin D, super important for insulin regulation as well. But also the anti-inflammatory component. When you look at women who have a pro-inflammatory environment in their body, that's not good for fertility, for fertilization of embryos, implantation of embryos. So it's all really important, and that's why you'll see a lot in the fertility literature, particularly on social media, a lot of attention being paid to what are you putting in your body, what chemicals are you putting in your body, what artificial things are you putting in your body, can you eat a cleaner diet when you're trying to conceive, can you stop smoking, can you stay hydrated, can you make sure that you're getting all of these anti-inflammatory foods in. And again, that all plays back into the PCOS. Again, whether or not women end up needing hormonal kind of help to get through overcome that fertility struggle with the ovulation, certainly those diet and lifestyle changes can make a difference.
So I gotta say, this has been such an informative discussion, and it really illustrates how complex PCOS is, and like I said, how many layers that there are. So if there's one thing though that you want people to kind of take away from this chat as they map out their journey with PCOS, what would it be? And Dr. Goebel, why don't you lead it off here?
Sure. I think, I like to think of PCOS management, looking at, to me, the three different facets of it. So regulation of menstrual cycles, whether that's for fertility or just for, regulation of abnormal bleeding. Looking at the cosmetic effects, how is your skin, how is the, abnormal hair growth, how is that affecting, your self-worth and, your body image. And then the long-term effects, your cardiovascular health, your risk for type 2 diabetes. So I really think that, treatment goals for somebody who walks into my office and who's 18 is going to be very different than somebody who's 30 and trying to conceive. Very different from somebody who's in their late 40s and thinking about, I've got a strong family history of type 2 diabetes, I have PCOS, how can I optimize these things? And so while, there may be medication options, there may be hormonal options that will apply to each of those situations, diet changes, lifestyle changes can be so important for a woman at every stage of management of PCOS, despite what her immediate treatment goals are.
So on my end, I think it can be overwhelming to change your diet. There's so much information, and depending on where you're starting, a Mediterranean diet could be very daunting for you. So I think it's important to take it in small steps. So, usually recommend starting with one change at a time. And it might just be that you're switching out your soda with a tea, like, an unsweetened black or herbal tea. Or maybe it's that you're switching out your, baked good in the morning at breakfast with some eggs or oatmeal. So maybe it's just choosing one change and then building upon that change to make it more manageable and more reasonable. So we all know ourselves better than anyone else. So kind of look inside, look at what you think will make the biggest impact and biggest improvement, but start one step at a time.
With everything both of you have said, I think anyone with PCOS should be leaving this feeling a little optimistic that there are things they can do to kind of take control and kind of help them move past the condition and really just live the way they want to live. So thank you very much for kind of really laying that out for us and kind of showing a path forward.
Thank you, Dr. Goebel, for joining us today. Really appreciate your expertise.
It was my pleasure. I think it's such an interesting and important topic, and again, so much that people can do on their own at home and to really just feel better with this condition.
Dietary changes often can help steady the hormonal imbalances that come with PCOS. Focus on eating whole foods with high nutritional value to ease and manage PCOS symptoms and lower your risk of related health issues. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, eat well.